more today. And then just this past spring, it seems like decades ago, we gathered your input on the equity profiles in our most recent health value dashboard. All right, and now we'd like to just throw out a poll question to all of you to get a sense of how you've been engaged with this advisory group so far. So we'll give you a few moments to select one of these options. Are you new to this group? We know that there are quite a few new members to this advisory group. We love to see this group expanding with new expertise. Were you a part of the equity consensus definition discussions? Did you attend that equity strategic messaging forum? Or did you provide feedback on the 2019 dashboard equity profiles? And maybe some of you might have been in it for the long haul and participated in all 3 of these activities. All right, we're going to go ahead and share the results. All right, about half of you have been in it for the long haul. Thank you for your dedication to this work. And then there are quite a few, about a quarter of you that are new to this group. And so you've got an overview of what this group has accomplished so far. It's pretty exciting, and we really look forward to working with you going forward. All right, so for those of you who are unfamiliar, we wanted to just review the dashboard a little bit and give you some background. The HPIO Health Value Dashboard is a tool we developed with input from many of you and other stakeholders to track Ohio's progress towards health value, which is a composite ranking that includes population health and healthcare spending metrics. The dashboard puts data in context by looking at Ohio's performance relative to other states, tracking change over time, identifying Ohio's greatest health disparities and inequities through a series of equity profiles, which, as I mentioned, we actually introduced in the second edition of the dashboard in 2017, and identifying evidence-based strategies to move Ohio towards improved health value. And this was a new component to the dashboard. Equity is a central theme in those last 2 components of the dashboard that I mentioned, the equity profiles and the strategies, and I'll talk a bit more about that. We heard from many of you and other stakeholders that the data in the equity profiles in the 2017 dashboard were very important to include and highlight. In updating the equity profiles for this iteration of the dashboard, we wanted to keep at the center of our minds our primary audience, which is state policymakers. Informed by conversations with many of you, we wanted to make sure that the equity profiles were concise and had effective narrative, telling a story that a policymaker could follow and emphasizing that a person's opportunities are driven by the environments in which they live. We identified 3 primary factors driving Ohio's poor health value rank in the dashboard. And one of those factors was generated from data in the equity profiles that demonstrated that we are leaving far too many Ohioans behind. Communities of color, Ohioans with a disability, who have lower income or educational attainment, and who are sexual or gender minorities experienced the poorest health outcomes and faced multiple barriers to health. In the dashboard, we also highlighted the number of Ohioans that would be impacted if gaps in outcomes were eliminated. And you can see some of those examples here around child poverty, high school graduation, and unemployment. And then finally, we highlighted the number of Ohioans. And then finally, we also took a look to see the strategies that could be effective at improving health value. And in identifying these 9 strategies, we looked to the evidence registries to highlight those strategies that had an impact on health disparities. And so the strategies that you see here that have been highlighted in the dashboard have research suggesting that they can in fact impact health disparities. And so that was at the center of our minds in identifying these strategies. All right, we'd like to open it up to some discussion and get some feedback on this new edition of the dashboard, and particularly the equity profiles, and whether you've used the dashboard equity profiles in your work, and how you've maybe used it to influence policy or communicate with state policymakers. So I'm going to take a look. If you would like to share, you can raise your hand, and then we will unmute you from our end. We have a couple of questions, so I'm just going to respond to those quickly. How many stakeholders are on the council? I think maybe this is referring to the advisory group. There are over 80 stakeholders on this advisory group that currently participate. Any hands raised? Nobody is using the equity profiles? Okay, Danielle.
Hi, this is
Go ahead.
Hi, this is Danielle. I'm at University Hospitals in Cleveland. I use them for our community benefit board presentations with each of our hospitals. And also I incorporated it into we have a community benefit scorecard. So every quarter we track, the progress that we're doing on the implementation strategies that we have. And I was, trying to figure out how to incentivize or figure out what, measurable way to incorporate that into our process. So I pretty much use the same definitions and things that you have on the equity profiles to kind of be the measure as to whether or not our strategies are becoming more and more equitable, so to speak.
That is fantastic. We love hearing that. Thank you for sharing. And I see a hand from Miss Angie. We're going to unmute you, Miss Angie. Make sure you unmute yourself as well. Miss Angie? Are you there? All right, Miss Angie, I think we're going to come back to you. Just make sure that you unmute on your end as well. And we're going to go to Lynn-Ann.
Hi, this is Lynn-Ann from Groundwork, Ohio. I think that when they were released, we were really excited to see that early childhood education and child care subsidies were included in the strategies. And so we shared these with our stakeholders as just strengthening kind of our case for support to have another nonpartisan research organization promoting these evidence-based practices that we know and we talk about how they eliminate both education and health disparities. And so it was really nice to have HPIO bolster those strategies as well.
Thanks, Lynn-Ann. And we have a comment from Heidi. The Healthcare Collaborative Greater Columbus intends to use the equity profiles as we continue to expand and support our new program, the Central Ohio Pathways Hub, which is a care coordination program that connects at-risk populations with various programs and services, both health-related and social determinants of health. Thank you, Heidi. All right, and Amy, Miss Amy has her hand up. Amy, we're going to unmute you. Lisa, we're going to go ahead and unmute you. I think we maybe had some difficulty with Amy.
Oh, okay.
Lisa,
thank you.
Go ahead.
Having a little bit of challenge with the raise your hand button, but I'm Lisa Sloan. My business is More Inclusive Healthcare, and we're not currently utilizing the dashboard equity profiles, but I can see the utility for them as I'm having conversations with health system executives who, sometimes, they're so high level, don't quite understand how they can impact healthcare equity, and the kinds of challenges that that they can impact if they were to be more, if their health systems were to be more engaged in healthcare disparities resolutions. So I can see using the profiles for that purpose.
Thank you, Lisa. Marie has a comment. Marie Curry, in Summit County, we've used the strategies to inform decisions about policy goals and to target our efforts. That is wonderful. We certainly hope that that is the case, that folks are using it for that purpose. Dina, we're going to go ahead and unmute you.
Hi, this is Dina Chisholm. I have used slides, particularly from the slide deck of the value dashboard, at a couple of large meetings to really set the stage for a discussion about where we are with health equity and where we need to get, particularly around research agendas and around organizational agenda setting. So I included slides and a presentation on health equity at the statewide Ohio Hospital Association conference, and also at the OSU College of Medicine Research Day, to sort of get students who are thinking about biomedical research to think more broadly about issues of health equity. So I keep the slide deck handy and borrow slides from it whenever they make sense to integrate into presentations for audiences as context and background.
Thank you. That is wonderful to hear. We do post all of our slides online, and typically they're in a PDF format. If there are specific slides that folks are interested in utilizing in the presentations that they do, please feel free to reach out to any one of us here at HPIO, and we can help get those to you. And you can also, Alana here in our office is typing, and also it's also on the slide deck page. Chart pack. Oh, there we have a chart pack available on our website. Okay, we're going to try to get Miss Angie unmuted again.
You able to hear me, Miss Rand?
Yes, we are.
Thank you. Thank you. So we have used the dashboard, the specific equity profiles in our work with healthcare systems, with payer systems, with legislators, with universities, and then also nationally with the National State Offices of Minority Health across the country. And so we use that as a mechanism to help systems see how they can use their data within their system to drive equity efforts. And our push within payer systems and health systems is to align the HEDIS score measures or whatever their measures are with their overarching quality improvement measures, to look at data by race and ethnicity, and look at how HPIO has highlighted their equity measures to create their own equity measures within their systems and create goals to reduce that.
Thank you, Miss Angie. We would love to hear of any progress that you've made on that end. I think that I don't see any other hands or comments, but I wanted to say that just listening to the different ways that everybody is utilizing the equity profiles in the dashboard is wonderful. It is what we put the dashboard out for, and so we hope that this conversation maybe sparks some new ideas and thoughts about ways to use the dashboard in the work that you're doing, or to influence policymaking through measurement or other means. I think we also have Chip on the line. Chip, I'm so glad you were able to join us. We're going to go ahead and unmute you.
Hey, can you hear me?
Yes.
Well, first of all, I'd just like to applaud HPIO on this dashboard. And I really applaud how you've actually been able, HPIO has used, pointed out the whole historical context of race and racist policies and made that connection to health issues. A lot of folks or a lot of organizations struggle with that. It's a bold move, but I think it actually helps level set the understanding regarding the impact of race and health. And so just kudos to HPL for being able to include that in the profile.
Thank you, Chip. We find this to be a challenging conversations to have. We certainly couldn't have these conversations or do this work without the input of all of you, and we really appreciate all of your contributions to this work. All right, so I think we're going to go ahead and move on. We've got lots of ground to cover this afternoon. Again, we really appreciate the feedback that you have provided. All right, that was just a reminder to use the hand icon. Now, we'd like to talk a bit more about the equity communication and messaging work we explored at the end of 2018. As I mentioned, in October of 2018, we hosted a forum and advisory group meeting for the Equity Advisory Group to share research funded by the Robert Wood Johnson Foundation, led by NORC at the University of Chicago, as well as research from the Arches Project, led by researchers out of Cleveland, to better understand the differing various beliefs and perceptions about health value and health equity. And at that meeting, we had quite a bit of discussion about what could be done to help advance health equity issues with state policymakers. And we were particularly focused on strategic messaging and communication. And so you'll see here some of the themes that really were highlighted by folks that attended that meeting. And these themes here really rose to the top. And that was for HPIO to serve as a bridge between advocates and policymakers, to provide resources to get stakeholders more comfortable talking about equity, to continue to engage with the legislature, and then to educate policymakers and stakeholders. Before we moved forward on identifying new work products, we decided to do a more comprehensive review of the literature to identify what was out there in regards to health equity communications and messaging. And my colleague, Erigina, who's actually in Chicago, so bear with us for any technological challenges, is going to share a bit more about what we found in doing that review.
Thank you, Rain. As Rain stated, HPIO conducted a literature review to learn more about messaging strategies and best practices for communicating health equity to policymakers, and that is embedded within the governing research question that you see on your screen. And yes, I am in Chicago at the National Academy for State Health Policy conference. After conducting the literature review, we found that most of the scholarly and academic research kind of focused on three broad areas, which were messaging strategies for communicating health equity to the general public, with the outcome of shifting perceptions and attitudes for policy acceptance, messaging strategies to improve overall health communication to the general public, healthcare patients, or health communication within public health systems. And lastly, strategies to communicate data and health science within public health with policymakers as a secondary audience. We identified that the strongest sources of evidence which directly address messaging strategies for communicating health equity to policymakers were nationally based guides and toolkits. Here's a snapshot of some of those guides and toolkits that are included within the equity messaging and research inventory. A key thing here is the strength of these guides and toolkits within the inventory are that the communication and messaging frameworks have actually been tested with policymakers and other stakeholders, including community, to ensure validity, and that the messaging strategies and frameworks can be applied to health equity communications and policy prioritization for groups most at risk.
Thank you, Erigena. Now what we'd like to do, and as Erigena shared, we did this comprehensive literature review, and what we found was that a lot of the academic and scholarly research was really focused on communicating to the public, changing public's perceptions about health equity or the social determinants of health, or even more specific to particular programs that might be directed at communities that are most at risk or have the highest need or the greatest health challenges. So they were often not as helpful as we thought that we would find. And so what we really ended up focusing on were these national toolkits and guides that really honed in on how to talk about equity with policymakers or decision makers. And so we're going to share a few examples of what these toolkits and guides include. And we're going to start with an example from the Voices for Healthy Kids Messaging Guide for Policy Advocates. And it talks about basing our messages to policymakers in shared values, as well as a common desired approach and outcome. The guide highlights a pair of shared values that resonated most with decision makers in their research and message testing, and these were the concepts of human potential and loyalty to community. They also found that there was agreement among decision makers when it came to the idea of targeted universalism and effectiveness as a desired approach and outcome. So to expand on this a bit more, this is the language that they coupled with each of these terms, and that can then in turn be shared with policymakers and other decision makers when talking about equity. So when we talk about the value of human potential, the guide suggested using language that indicates people being able to reach their full potential, which is actually the same language that we used in our health equity definition. In talking about community, it was suggested using language that indicates that equitable policies help communities work together and be stronger. So having this emphasis on communities working together and how addressing equity can really strengthen a community. And then the guide also suggested language around targeted universalism and effectiveness. And you'll see here that this translates into this message of we want everyone to benefit, but must start with the communities that have the greatest need. And the policy, in order for it to be effective, needs to do so that it has the intended impact and resources are not wasted. And this idea of having the greatest impact and not wasting resources was a concept that really seemed to resonate with decision makers when they did the message testing for this guide. You can begin to see how these different concepts and values, when pulled together, can really help in communicating about equity issues to policymakers. And Erigena is going to share a few other frameworks from these guides and toolkits that we compiled that we found to be helpful.
Thank you, Reem, for providing a great foundation for us to explore some of these messaging frameworks. So our second example comes from the GEAR Communications Guide, and it illustrates a structural message approach for communicating health equity to policymakers. The setting might be in person or in written form. The Affirm, Counter, and Transform framework follows affirming the core values of your audience or shared values of your audience and or listener at the opening of your message. During the counter, you would focus on challenges or structural barriers that create inequities and disparities, and using facts and data to substantiate those set forth challenges is key at this point of the message. And lastly, you want to end your message with a transformative statement. So the transformative statement would open with reaffirming the collective effort, and then it would lay out steps to transform conditions. So an example of that would be policy recommendations. And so here we've taken messaging from the 2019 Health Value Dashboard and applied the Affirm, Counter, and Transform framework. And so I'll give you a moment to review that, but building on the value-based narrative, you will see that some of that human potential language is interwoven throughout each step. And so if we look at the Affirm, we are affirming that health is the shared value. The Counter focuses on Ohio's health rank and what that means for all Ohioans. And the transformative statement really speaks to the policy strategies set forth in the Health Value Dashboard that works to improve health outcomes for all Ohioans. Our last framework example comes from Voices for Healthy Kids Health Equity Messaging Guide. The framework provides a tool for policymakers and legislators or persons working with those parties to use and ensure that equity is integrated within policy language at all phases of the policy process. So here we have adopted a criteria for equity language and policy, and we'll give you some time to review each one of those criteria. But the key thing is that policy recommendations, agendas, and legislation could potentially utilize a criteria list to incorporate equitable language and ensure policy prioritization for groups most at risk for poor outcomes.
All right, thank you, Airagina, for sharing those examples. And we wanted to just get a sense from the group how they felt about these different examples that we shared with you. Were these frameworks that we shared helpful, useful? Did one resonate more than another with you? We just wanted to open up with some discussion and see if you had any thoughts on these different examples that we share that come from these national guides and toolkits. And just remember to raise your hand, use the raise your hand icon, and then we can unmute you. All right. I don't see any hands. And please feel free also to type in to the question box and we can share your thoughts. Were some of these examples useful as you're thinking about messaging to policymakers around equity? Were they not useful? Do you need to know more? Any thoughts? All right, Danielle, we're going to go ahead and unmute you.
Hi. Yeah, I think they were definitely useful. Anything that helps people to digest and take in and have common ground type of language, I think is helpful. the one that stuck out to me was ACT, and not just because of the simplicity of it and the acronym. It's something that you can remember even if you happen to catch somebody in the elevator. Like, I feel like you can remember ACT. Like, let me get my little speech together, even if it's like an impromptu moment. But yeah, I think these things do resonate, and whenever there's some credibility, like a national guide or whatever, that for whatever reason means, more to somebody, you can hand to them and say, no, I'm not telling you this because it's common sense. I actually think, you can look at this, national study by so-and-so or whatever. And I really appreciate that you guys have taken the time to do the literature review and to have it tested with audiences, because it just reaffirms things that I think the folks on this phone probably experience anyway.
Thanks, Danielle. We're gonna go ahead and I see a couple comments that say that these examples are extremely useful. Marie, you said something about SCCHI. Oh, you wanted to talk. Okay, we're gonna unmute you, Marie, so you can explain.
All my acronyms. Can you hear me?
Yes.
Okay. So this is great, and I was familiar and with that the first tool about equity messaging, and was able to share some of that framework in Summit County with the Summit. We have a Summit Coalition for Community Health Improvement, and we have a policy committee, and so I kind of walked through some of that with the policy committee. But the ACT framework is new to me, and it does resonate. Like the speaker who just shared her thoughts, it's simple and it feels more concise and more doable to me. More like you could put 3 sentences together and get them out than. I mean, I suppose if I went back and look at the value-based narrative framework, I might be able to figure out how to tighten up what I wanted to say, but it just felt more spread out.
Mm-hmm. Thank you, Marie. Oh, I'm seeing a lot of comments. I'm gonna read a few of them. Wow. Okay. All right. So we say framing and starting from the stakeholders' interest is smart. And I think, Steve, you shared that you really liked the last example and that it showed the elements that should be present in considering how policies address equity. Yeah, each of the examples we shared was a slightly different way to either talk about health equity with a decision maker, or once they're at the point of really wanting to do something, what some next steps might be that you could share. Heather, you're sharing that targeted universalism has been a helpful method that you've used both in work and community work, and helps illuminate issues that people have different starting points. And then let's see if there's more. Lynn, you're saying that these are useful and consistent with your work and findings. You've also found that the messenger is equally as important as the message, if not more. And that was definitely one of the themes that we found in these guides as well. Do we have anybody else with their hand up? All right, I think that's it. Okay. Well, thank you for that feedback. And with that, we're going to transition again, and just really building on this discussion that we've had. We wanted to propose something to you all. Sorry, the computer's a bit slow. So given what we found and what we've heard from you now and in previous discussions, what we thought might be useful is to develop a messaging guide that really synthesizes and summarizes these existing tools and resources with the purpose of supporting your efforts to more effectively communicate to policymakers about equity. So what we found is that there are a number of different national toolkits and guides that have very helpful information, and it might be helpful to all of you if that information was put in one place with the common themes synthesized and summarized, so that it would be maybe a more handy guide for you to utilize in any communications or messaging work that you might do with policymakers or decision makers. And so this is just a logic model for this work, and I'll give you a second to review. You'll note that 2 of the intermediate outcomes in yellow are that policymakers become open to the need to address disparities and inequities, and then that policymakers then prioritize policy language to do so. And so those would be some of the outcomes that we'd like to see from this work, with a starting place of having this resource guide. And I'd like to get your thoughts on whether or not you think this would be helpful. How could we maybe improve upon the purpose of this, and just really any other thoughts that you might have. So again, I'm going to open it up to some hand raising, and again, feel free to type into the question box your thoughts. Would it be helpful for us to pull together this information into a more concise guide that really synthesizes the themes and highlights some of these examples that maybe you all find more useful? Or is this too duplicative of things that are already happening? Is there another product that could be more useful, or could this be transformed into something that would be more useful to you in your work? Please feel free to share your thoughts. Okay, so can we put the logic model back up? Yes. And this is just the logic model that we have developed to think through, okay, what is the end goal of this work? Danielle, you're saying definitely helpful, especially because it will be tailored to policymakers. All right, and then I think Miss Angie has her hand up. No, not Miss Angie. Steve, you have your hand up. We're going to unmute you.
Hi, yeah, if I got the question right, it's how useful is this logic model, or what other resources? Is that correct?
It's how useful would it be for HPIO to synthesize? So this logic model is a logic model for a guide that we could potentially develop that synthesizes the information from other national toolkits and guides around equity messaging. So the question is, how useful would kind of a summary guide be in your work, and if there are other resources that we should consider including?
That ends up being pretty abstract for me. So my answer is maybe, but I will also say that the document that you already did share, the framework to eliminate racism, and maybe that's something you're getting at. I really like that, and that's helpful for me to be able to think about things.
Okay, great. We will definitely get into discussion about that framework. So that is a separate framework that we are working on to address racism, discrimination, and other isms, and we're going to talk about that in just a bit. But just wanted to get your thoughts and feedback on a summary guide, a summary messaging guide around equity that would be targeted towards policymakers. And we're going to unmute Lisa.
Thank you. So one recommendation that I could make would be to maybe develop a one-pager that, maybe a table that shows some specific topical areas for communications, and then where those can be found within the existing resources. So it's more of an at a glance. Here's where to find the kind of information that you need to develop your own communications messaging. I mentioned that because we have developed briefs utilizing the work of key driving organizations, and then we developed a one-pager, and we actually had a lot more uptake of the one-pager with feedback from stakeholders saying that they got more utility from that because they had time to actually take in the information that was at a glance rather than reading through an entire brief. So just food for thought.
Thank you, Lisa. That's very helpful to hear. I think we always try to strike a balance between being comprehensive and concise, but you're right. It's what's most useful to other stakeholders is going to be something that's simpler, more concise, a fact sheet, one pager. That's definitely something that we'd be interested in doing. Miss Angie, we're going to unmute you. Miss Angie?
Ms. Ream, I do want to share what would make the brief extremely valuable for the commission, and the way that it can be useful for us is to make sure that there is consistency in our language, in our messaging. So if we're talking about equity, we use the term equity. If we are talking about injustice, we use that term, or social determinants of health, to make sure that we are using the term. I want to give kudos certainly to HPIO and the work that you all have done with stakeholders across your 2014, 17, and 19 dashboards. I can't tell you how refreshing and how, I'll just use the term joyful it is for me to actually engage with legislators who are using terms like equity and social determinants of health within the proper context, and they know what it means, and they know what policy work has to be done. And so I think to continue to build on that work, to make sure that even as we are looking at messaging and language, that we build on the work and we call, social determinants of health, social determinants of health, because we have worked to get that language in a common level, and that we continue. That's how the brief would be most valuable to us. And then I can forward you a couple documents that we have from the national level on equity communications.
Fantastic. Thanks, Miss Angie. Yes, and I definitely, please forward me those resources because we can add them not only to the resource page, but then if we are doing some follow-up work around communications and messaging, we would help we would use those to inform that work. Thank you. Liliana said that the tool would be very useful and it can be easily adapted to share with the Latino Hispanic community that they are working with. Thank you. Other thoughts on this? No other hands raised, no other comments? So can I just get a general sense from folks, should we move forward with some sort of tool or guide like this, whether it be a one-pager, and we can, most HPIO products that we put out have a one-pager that accompany them, so it could be maybe a little bit of a longer and then a one-pager, and then incorporating some of the feedback that we heard on this call. If you don't think that this would be helpful, and I know Steve, you said that it's still in the abstract, so it might not be as helpful to you, could you please type that into the question box and let us know, particularly if you have kind of strong feelings that it might not be useful, or strong feelings about what would make it more useful. Feel free to type it into the question box. Okay, we're getting that you would use the tool with an executive summary. See, Marie, you know our work, definitely with executive summaries. And Robert, thank you for sharing. It's a great idea. Okay, And please continue to provide feedback on that, even though we're going to be moving forward in the discussion. Okay. All right, and so Steve has already alluded to this, but you have a handout uploaded on this webinar that we'd like to discuss in just a moment. We want to transition to a discussion about the key driver of inequities and disparities, which is racism and discrimination. And I just want a reminder that if you raise your hand, please make sure you leave it up until we get to you, so that we don't miss anybody. We want to share this framework, this is not an HPIO framework. It's one that exists in literature around the 4 levels of racism to get us thinking about, how can we address racism? Racism is often understood as being limited to that interpersonal level, which is the bias that occurs when individuals interact with one another, and their personal beliefs impact those interactions. But we really want to think about how we can address racism across these multiple levels, both at the individual level and at a more societal level. And so when we talk about racism, we're also thinking about internalized racism. So those are your own beliefs, and they may include being prejudiced or discriminatory towards others, or even having negative beliefs about your own self if you are a person of color or a person that is in a group that is oppressed. Or even having beliefs about the superiority of one group over another group. And as I'm talking about this, we are using the racism framework, but just keep in mind that this framework can also be used to think about other isms, ableism, sexism, or other forms of discrimination. Then you have institutional racism, which refers to unfair policies and practices, discriminatory practices at an organizational level. And for example, these can occur in schools or within your workplace. And then we have structural racism. And this is really where we start talking about policy. And it involves cumulative and compounding effects of all these different levels of racism, including the ideology of institutions and policies that systematically and systemically privilege one group over another. And I want to share this just to get our minds around, when we talk about addressing racism and discrimination, what are we really dealing with? What do we mean? So I'd like you all to take a look at that handout that we have uploaded. We know that tackling equity can seem very overwhelming, particularly to stakeholders that this is kind of new information for them. And when we talk about eradicating the consequences of historical and contemporary racist and discriminatory policies, that can seem very overwhelming. So the handout that you see here is what is the product of a preliminary process in developing a framework to address racism, discrimination, and other isms. And we'd really like to get your feedback on this framework. This first side that you see on the screen here outlines what can be done at the individual or group level, at the organizational or institutional level, and then at the systemic level to address racism and discrimination. On the back side of this handout, you'll see that we have a table that we plan to fill in with examples of resources that someone can go to if they want to take any of the action steps that are listed. I'm going to give you a minute or two to review this handout, because we'd really like to get your thoughts and feedback on how it can be strengthened. So I know that this is going to be some dead silence. That's okay. And please note that this document is under the handouts, and it's the equity framework draft. So if you can't find it, if you look at your webinar toolbar, it is the equity framework draft handout. as you're looking at the handout, if you can be thinking about these discussion questions, how can this framework be useful to you in your work? Do you have any suggestions for improving the framework? And then in thinking about that backside, if you're aware of any resources that we can include at any of the different levels, we'd love for you to send that along to us or make us aware of what those resources are. So just be thinking about these questions as you're reviewing this framework. If you have thoughts, please go ahead and raise your hand. Also feel free, of course, to utilize the question box. Okay, we see some folks are typing. We're gonna just give a few more seconds. Okay, I'm going to unmute Robert.
Okay, can you hear me?
Yes.
Yes, so to address the systemic racism through policy change, I would suggest that this group work with Representative Erica Crowley's office in any capacity you can to support the Health and Equity in All Policies legislative initiative. And that is, for those who are not aware, a process by which all potential legislation, all proposed legislation would go through a health and equity lens prior to becoming law. That's the short version.
Thank you. And you'll note that the bullet 2 under what can be done at the systemic level highlights that. So equity impact assessments on proposed policy. And that's a great example of what that might look like. Thanks, Robert. Okay, we have quite a few questions in the question box. So I'm going to try to get to those before unmuting anybody else. Let me start at the bottom and go up. Okay, very small change, thinking about readability and some crossover with individual and organization, such as training and coaching. Could these shared items be listed one time? Okay, we can think about how to best do that, because there certainly is overlap in what can happen. It's really about who is doing what. So at the individual or group level, that would be really the individual that is participating or taking the initiative to participate in these trainings. And then at the organizational level, it would be the organization either requiring or providing these resources to either those they serve or their staff. And so I think maybe we need to clarify that a bit more. Thanks, Heather. Kelly, can you clarify, did you create this framework from your literature review, or did you find the framework and adapt it? This is something that we are creating based on the discussions that we have had through this advisory group with other stakeholders, through the literature that we have found. It is not a framework that we are adapting from any one source. It was very much, though, inspired by those 4 levels of racism that I shared, I just shared with you. Okay, this is from Marie. Are you distinguishing institution, or no, this is from Steve. Are you distinguishing institutional and structural by whether the racism occurs within the institution versus whether the institution develops policies that impact outside the institution? So institutional racism is racism that occurs within institutions, whereas the structural racism is talking about the compounding effects across institutions. So that is how we would distinguish the two. I think we have other thoughts. Okay, any other reactions to this? Any other hands raised? Yes, we see lots of. Danielle, we're going to We're going to unmute you, and then Dina will unmute you next. Okay, go ahead, Danielle.
This comment probably could apply to all three, but may most likely fit under the individual and group level. I'm thinking about a way to capture stories of people who are most affected by racism, just that we create some space for voice around, people. And stories are always powerful ways to attract people's attention. And in line with that, in terms of a source available, in Cuyahoga County through First Year Cleveland, we are producing a movie and discussion guide primarily focused around the Black infant mortality rate, but it's transferable to many different types of things related to health equity, which will be completed in the next couple of months. So that's something that we definitely want to get out there once it's done.
Okay, that's helpful. I think we'll give it more thought, but it seems to really fit in at what can be done at the organizational level, which is collecting and compiling stories or narratives. And so we can certainly think about where best to include that in this framework. Thank you. Dina, we've unmuted you.
So I'm looking at the title of this framework and just sort of thinking about, is the goal to eliminate racism, discrimination, and other isms, or to eliminate the negative health outcomes of racism, discrimination, and other isms? Because I'm not sure that those are exactly the same thing, and the things that I'm reading seem to be more focused on eliminating the negative health outcomes, not eliminating the thought processes necessarily that drive those words. So,
Okay. I definitely think we can give that more thought, and kind of parse out what would be included and what would not be included depending on what that title might look like. So we might spend some more time with you, Dina, thinking about that. All right, we're going to unmute Lisa.
Thanks again, Reem. So kind of piggybacking on what Dina just mentioned, I had some uncertainty as well around, are we talking about eliminating racism and discrimination or the negative health outcomes? And with respect to eliminating negative health outcomes at the organizational level, one thing that I would like to see added is the use of data, including quality measures and demographic data, to identify disparities in care at the health system level. And I believe that having some public reporting in that regard, some transparency in that regard could be extremely valuable. And that would very likely have to be driven from the policy level.
Thanks, Lisa. We definitely see the collection, reporting of continued surveillance around data to be a critical component both at the organizational level, so healthcare systems would be an example of that, and then at even more the systemic level to make sure that the policies being implemented are having the impact that we want them to have. And so we can think more about how to strengthen that language. Thank you. Other thoughts, questions? I'd like to hear from folks who think maybe this is not a particularly useful framework. Of course, we want to make sure that this is something that resonates with all of you, that this is moving in the right direction. We don't want to work on something that is really not resonating with folks. Or if you've seen similar frameworks that you think, maybe we should stick to or adapt or that exist, we'd like to know about that as well. Okay, Lisa, just clarifying that you're talking specifically about the use of data at the clinical level and reporting on those outcomes and not just about surveillance. Thank you for that. We have one hand up. It's okay, Dina, we're going to unmute you.
Just had one other thought as I was looking at this, thinking about sort of alignment and thinking about using some structures that already exist, like the Camara-Jones framework for racism, focusing on, interpersonal and systemic, just thinking about how we can use frameworks that are already in existence and overlay them.
Okay. Dina, if you could share those with us, that would be great. So any other ones that you are aware of or can think of, if you can send them our way, that would be wonderful. Other thoughts on this? Do you think that this is a tool that could be utilized by policymakers, or something that you would be willing to share maybe with a policymaker or other decision maker within your community? I can't tell if the silence is good or or if it's thinking, or if it's not, it's just not resonating with folks. Okay, I'm getting some feedback that yes, absolutely. Thanks, Marie. Okay, we do have one hand raised. Renee, go ahead. Renee, we've unmuted you. Make sure that you unmute on your end so you're able to speak. All right, it's not working. Steve, you said yes, helpful if they are sold on the need to address equity. You're right. There is two components to this. There's that getting them to the place where they know that they need to do something about it, and then here's what they can do about it. So there's definitely a step before this. More examples, best practices should be added to understand and share. Thanks, Kelly. That is our goal. So if you are aware of any other resources that we can include, we would love for you to send that our way. This is just preliminary, so it's a draft. You're kind of seeing things fresh, hot off the presses, our thoughts, and so we're definitely going to spend much more time with this and get more feedback from all of you as we continue to develop. Heather, you're asking about leveraging other partnerships. Yes, we had some thoughts about doing that, so I think we're going to probably act on those in the next few months. She really was one of the inspirations for doing this. Other hands raised, or thoughts or questions? This is the last discussion point that we have. We do have one hand up. It is Renee. Renee, we're going to try to unmute you, and hopefully you can come through. Go ahead, Renee. Renee, you are not coming through, and I don't know what's going on our end. Okay, Lisa, you have your hand raised. We're going to go ahead and unmute you. Renee, if you want, you can type into the question box and I can read your comment. I want to make sure that we are able to address what you wanted to say. Lisa, go ahead.
Yeah, just one other quick comment, and that is are we thinking about how to measure success? So, if an individual or an organization or system were to implement any of these possibilities for solutions, are we thinking about ways to measure the outcomes, or can we give some, recommendations or best practices around measuring outcomes? One of the things I also thought of in that regard is, when we're looking at data, we look at national data, and then we, start breaking it down by state. It looks a little bit different. We look at it by organization. It looks even more different. And, at the organizational level, we actually have the opportunity to impact individuals and make some real serious change. So, but being able to measure in some ways is really important.
Thanks, Lisa. We would agree to that, and we're interested in exploring more different measures around racism and discrimination. So how to measure racism and discrimination. If anybody, again, has any resources around that, we'd be really interested in taking a look. But I completely agree with your comment. Okay, I think that those are all the questions that we have, and there doesn't appear to be any other hands raised. Renee, please feel free to follow up post-webinar. We are recording this webinar, and it will be posted for folks if they want to go back and take a look at some of the things that were shared or said. And of course, we're going to continue this conversation. This is always just the beginning of a journey. So as far as next steps, we will be thinking more about this messaging guide and putting something together for all of you to react to in the next few months. And then we'll also be working more on this framework. We may reach out to some of you who have shared comments and feedback to see what your thoughts are on this and how we can strengthen the framework and make it more useful. And of course, if there are any other thoughts or suggestions or questions that you might have, please feel free to contact me or Regina. And our contact information you should all have, but is on one of the slides in this slide deck. So feel free to reach out, or to any other member of our HPIO team. They'll make sure that we get the information. Thank you again, as always, for a robust discussion and being engaged in this work. We really appreciate your feedback. Have a great rest of your afternoon.